All right, everyone, it is 6 o'clock. Just for the keep everybody on schedule here, we will get started. Hi, everyone. My name is Matt Smith, and I want to thank you for attending our webinar today. I am a senior partner / financial advisor here at Wealth Distribution Strategies. Here at WDS, our mission is to help our clients achieve their financial, family, health, charitable, and social aspirations one conversation at a time. And so tonight we're going to be discussing long-term healthcare and assisted living options. You can expect Darian to have the floor for about 45 minutes. We're going to conduct a short Q&A session at the end of the webinar. And so the webinar is going to be recorded. So if you missed something, you have to step away, or you have people that you'd like to send it out to, or direct them to our website, as it'll be up on our website. Give us a little bit to get it up there, but you can direct people there. So if you have any questions during the webinar here, go ahead and feel free to put them in the chat window, and we'll try to address them at the end during the Q&A sessions. Darren, you're lucky. We already have about 10 questions that were sent in beforehand. So, you got your hands full here. So today we're going to learn with Darian Dullison from Comfort Keepers. Darian is the external care coordinator at Comfort Keepers, and so he works with families to create personalized plan of care. That role makes him the perfect person to educate us tonight on what options you have when planning for care and how to put that plan into place. Without further ado, I'll hand the floor over to Darian. Thank you, sir.
Thank you very much. I appreciate the opportunity to be able to talk and have the opportunity to help educate people about long-term care planning. It's a pleasure of mine, so thank you. Well, first, this is it's an open format, but I do have an outline and a plan for the time. I really enjoy questions, so I will end up addressing the questions at the end of this. But just a little bit about my experience. I have been with Comfort Keepers. We're a home care provider for about 9.5 years now, and my main responsibility is to be able to twofold, well, actually threefold now, is I work with families to be able to meet with them, and then to be able to talk to them about primarily it's home care that we're looking at, and being able to talk to people about signing up to have our services, to have a caregiver come into their home and be able to provide home care services for them for various duties, whether it's like housekeeping or assistance with activities of daily living, which you will probably hear me say that a lot tonight. But an activity of daily living is simply assistance with showering, dressing, undressing, meal preparation, laundry. Those are some basic type of things. The things that we do from the time we wake up in the morning to the time we go to bed. So that's the way I look at it and explain it. But the first part is that my job is to be able to meet with people and determine what really their care needs are, and then develop a plan of care. Second is to meet with referral sources, whether that's hospitals or clinics or senior centers, businesses, to be able to talk to people about who are their clients, and do they know someone that could utilize help, and could it be something that we could have an opportunity to be able to connect. The third part of my job is to do complex case management, and really what that means is someone who is experiencing a life-changing health condition, whether it's dementia or MS, or it could be a variety of health-related issues, and to help them navigate through, whether that's attending a doctor's appointment or coordinating care, being able to help with resources to be able to get that person connected to various opportunities throughout the community to be able to help, and also to be a patient advocate. That is a phrase now that has been utilized within the community quite a bit, but is really just a person who has the best interest of that person, and understands what the person's needs are and the complexity of their situation, and can be an advocate for that person. But so the discussion tonight will, I'll start with really talking about how to develop a plan, and then really go into the various levels of care. But the first part is with long-term care planning. Many times people will spend, 20, 30, 40 years planning for retirement. They plan for that day that they're going to retire, and they have that goal, and that's been something they've been dreaming about, for, again, 20, 30, 40 plus years. Retirement looks different for everyone, and how typically people prepare for that is through a financial advisor and through financial planning, being able to prepare for that, for a day where you can either pick what you want to be able to do, for a living, or not work at all, be able to travel. What people really don't really focus on at all is the long-term planning for care. At that point, is that what I always use as an example is the people may remember, the magazine, a Money magazine, and yearly they came out with a subscription that talked about when you retired, it was a couple walking along the beach holding hands that were, in their mid to late 60s. And what I always talk about to people is you prepared for that very well, and you did that really well. But what happens then in, 10, 15, 20, 30 years after that, when healthcare needs are predominant and you need care potentially and need services to be able to help you with that? And what does that look like for you? How do you manage through that? That's where someone like me comes in. But it's really, I would ask everybody in the audience, when is the last time that somebody has been in a hospital, like just even visiting? Probably, more often people, visit hospitals or skilled nursing facility. But in general, people don't go to assisted living facilities, and they don't really understand what that is and what that looks like. Usually the first time somebody sets foot in a assisted living community is when they're either looking for themselves or looking for a loved one. And in most cases, it's a person, a family member is looking for someone else. So usually a person themselves is not looking. What I would challenge you all tonight is really to create a plan to be able to, you really are in the driver's seat, and to be able to understand how to develop a plan, and that you can do that, and then you can outline that. Not to say that having someone be able to do that planning for you is a bad thing, but that many times people just really push that discussion aside when it comes to long-term healthcare planning, and then other people end up planning for you. And some people are perfectly fine with that, but for people who really want a person-centered approach to care and want to be able to live out their life the way they want to, when it comes to their treatment and areas where they have preferences, such as where they want the care to be provided, whether that's at home or an assisted living facility, really look at having a plan. The first thing is anyone that is over the age of 18 should have an activated, or should have a healthcare power of attorney and a financial power of attorney paperwork drawn up. Typically, though, what people do is they end up meeting with someone, or they get the information online, they end up filling that paperwork out, and then they really don't know what it means. And I'll say to somebody, well, has your power of attorney been activated? And someone really doesn't know what that means. And I'll go into more detail of what that means. But people a lot of times will do their planning for their will and their estate planning, and they'll have the power of attorney information in there. What I would encourage people to be able to do, because in the state of Wisconsin, your spouse, if you're married, doesn't automatically become your power of attorney for healthcare. You can pick anybody that is over the age of 18 to be your healthcare power of attorney. Many times people pick spouses and they pick their kids. I would talk to your spouse, and I would talk to your children about what that means and what that would, and that responsibility, because it is a higher level of responsibility that they're taking on with that role. And why I say that is because at that point in time, when they become when it's an activated power of attorney for health or for finances, that person is making decisions on your behalf. They're not making the decisions what they believe is the best and then is in their best interest. They're making decisions that are in your best interest. And so that's really where, and it's a lot of work. I mean, it really is. Uh, it is it's a long-term commitment because someone could have an activated power of attorney for many years. Sometimes people don't ever have an activated power of attorney, and that's perfectly, fine to be able to have happen. But most people, when a power of attorney's been activated, it's been activated for a long period of time. But what I would really do is talk to the person and talk to the people to be able to have that you want to be able to be your advocate. See, and when I did mine, because I'm a facilitator through the Wisconsin Medical Society. So when I did mine many years ago, I had to directly go and talk to the people that I was going to have as my advocate, and I decided on my wife to be able to be my first one, and then my second was my aunt. And I talked to her about what my preferences would be if she were to make decisions on my behalf. And at that point in time, she paused and said, "I don't know, Darian, if I agree with what you want to have done, and I don't know if I can be your healthcare power of attorney." And I go, "Thank you for telling me. I appreciate that. Let me just stop the conversation here. Let's reconvene at a later time, and you talk to me about what you think, and if you still don't want to be able to do it, you tell me, and then I can talk to someone else about that." And we really had a good discussion about that, and we ended up talking about what really the medical preferences are. Now, many times people think of the power of attorney as what people will call the pull the plug type of conversation. It's somebody who's in an accident, somebody ended up having a situation where they're in the emergency department, and a physician is going to someone and saying, they're on life support. Do you want this? Yes or no? And that can happen. That can happen to anybody, but that's typically not the case. It's usually after someone has been, has an activated power of attorney for many years, and that person, that advocate, is making healthcare decisions on behalf of that person for that person, whether it might be because of dementia or because of MS or some other comorbidity, some other chronic illness that does not allow them to be able to make healthcare decisions on their own. But really, what I would look at is getting the detailed information to the person and to the people that you want to be your healthcare advocate, and to be able to make sure that is a person that really understands your preferences. And also, if your preferences over time change, which that is normal and is healthy to be able to have done, is that people have differences of opinion. When you were, just think of when you were 20 years old versus when you were 50 years old, your opinion is different, and you have different opinions potentially on what type of level of care you would want, or what type of situation that you would want done. So when those preferences change, then make sure those things are documented. But first and foremost is being able to draw up the documentation, and then for the power of attorney for healthcare and for finances, and then to be able to really, you can put information into that document that really goes through what the preferences are, how you want treatment to be done. It's the basic questions are usually you are giving the permission to enable that person to allow you to go to a skilled nursing facility or to a community-based residential facility, which is an assisted living community, or have G-tube feeding or have a ventilator. So those are some of the basic things, but you can add anything you want into that. You can say all of the things in very descriptive of what you really want to have done. So that's really your preference. So that would be the first thing that I would do to be able to make sure is get that document, drawn up, and then really put your preferences in there. I'm spending a lot of time on this because it's one of the areas that I spend the most time with people, because when I meet with people, the first thing I say to people is, do you have, a healthcare power of attorney? And they'll go, yes. And I'll go, well, is it activated? And that usually tells me right away whether they understand the document that they have in front of them. Because to be activated for the healthcare component, two physicians have to believe that you are unable to, because of your health condition, able to make sound healthcare decisions for you. So it's a really strict guideline that the state of Wisconsin has for that. So it's not, not everybody has an activated healthcare power of attorney. You can have it drawn up and not have it deactivated. So being able to understand that language, whether it means you have a power of attorney or whether it's being activated or not. The writing down the likes and dislikes of, there is a health condition that you have, let's say dementia. How do you want your life to be? What do you want the where do you want to live? Do you want to live that home? Are you that you should have written up and then revisit, every couple of years, being able to go, because things change. You may have a divorce. You may your spouse may ended up unexpectedly dying, and now you're a widow, and now that person who you had as your power of attorney for healthcare now has died, and what you are people able to hear me? Matt, is everybody able to hear me? Okay. All right, let me see if I can maybe able to switch it here. Oh no, that's too bad. Yeah, I'm getting that warning as well. Okay, I'll try to let me know if it ends up happening again. So that's that for that. Okay. Once the healthcare power of attorney component is taken care of, then what you have are, you're retired and you're living, and what you're really looking at is you want that document to be a reflection of who you are. One of the biggest challenges that families have are when a crisis happens, which a healthcare crisis happens to many people. What the challenge is that when a healthcare crisis happens, people don't really know how to respond and how to end up. So what a healthcare power of attorney paperwork does is enables people to really look at what the guide, and that is really the guide for you to be able to understand what to be able to have done. Now, some of those decisions are out of your hands at times, because when someone has a healthcare crisis, the doctor and the nurses, and that really primarily the doctors who are working with you, have really control in that situation. And then when they're really at a crossroads, that's when they're really looking at a healthcare power of attorney to make additional decisions at that point in time. So, and people really don't understand that as well. When it comes to the type of care, many times people will tell me that the first thing is that I never want to leave my home, and I want to be able to have care in my home and to have that done at my home. And that is perfectly fine to be able to have that done. However, what you need then is a plan of what that looks like, and what, then I would have the ability to understand what the cost is and to be able to go and look at the cost. Like I can tell you today in Madison, the cost per hour to be able to have a home care provider in your home is, between $35 and $40 an hour. And typically there's a minimum anywhere between 2 to 3 hours up to 8 hours for one shift. So you're looking at several $100s a day to be able to provide care, up to almost $1,000 a day if you're looking at 24-hour care. So many times people look at simply the preference, I want to stay home, and then aren't really looking at the cost that's associated with that and to be able to do that. So what I would really look at is being able to, when people around you are starting to look at you and say, you need more assistance, or I think it's time to look at more assistance for you, whether that might be help with, simple things. It might be laundry. It might be just basic house cleaning type of things. Is I would start smaller and I would start sooner than later. Many times people don't want to do that. They don't want to end up having the inconvenience of having someone in their home 1, 2, 3 times a week, because it's difficult to be able to have someone in your home to be able to provide the service. But typically what I will talk to people about is, by the example I always use is laundry. That's a simple explanation, but what will happen many times is people will say, I can still do laundry, but it's exhausting to do laundry. I'm not able to do laundry. It takes me 6 hours to do one load of laundry because it's physically exhausting to be able to do it. Now, being able to then look at a home care provider to be able to do that, one simple thing, that one simple thing enables that person to be able to stay in their home for a much longer period of time. So to be able to do that. So those are small things, but is people having the humility of being able to understand that they're do the task at the same level that they did 5, 7, 10 years ago. Are people still able to hear me?
Yes, you cut out a few times, but yeah, we can still hear you. Are you there? No, it looks like we might have lost him.
I couldn't hear you at all in that.
Oh, go ahead, Darian. Yeah, we lost you there for a second. Maybe Darian, one thing that you might try is just, obviously we'd love to see your face while you're talking, but one thing might help with bandwidth is just turn your camera off and just go that route.
Okay.
Okay. Okay. Yeah.
Oh. Is that better? Able to hear me better?
I can hear you now. I couldn't hear you before. It kind of just comes and goes.
Okay, I'm going to try to switch because I'm going to see if I can switch my platform and see if we can figure it out. So I apologize. I'm sorry.
No, no worries. I can hear you perfectly fine now, but.
All right, I'm going to just switch over here and see if I can get you.
Okay.
See if I can switch over.
Okay.
Yeah. All right. I'm just gonna try to log in through my phone and see if I can get a better connection through my phone.
Okay, I mean, I can hear you right now.
Oh, you can? Okay, all right, perfect.
Yeah, I can just
All
pop
right.
in. I'll pop in if you cut out and just,
Okay, yeah, perfect. No, I appreciate that. It's
okay,
so
sounds good.
the uh the piece is many times people will look at, when I sit down with somebody that they're extremely reluctant to be able to have care in their home, and that's understandable. It it all really fits into though what your goal is. So if someone tells me that, as an example, if someone says I, want to be able to live in my home throughout the end of my life, and then I end up wanting them to that not and but I don't want to end up having any support in my home whatsoever, most likely those two things can't really happen. That at some point in time you're going to most likely need assistance. At, and what I'm currently seeing in the market and in the Madison area is that, as an example, I just talked to an assisted living facility on Friday, and they were looking at having a referral come in, but they weren't able to do the admission and as quick as they needed to. But the nurse from the facility looked at the record of the person who was potentially going to be a move-in, and what they found was that the person wasn't even eligible to be able to live in their assisted living facility, that they had to a high level of care. And what that really meant was that now they were, instead of looking at an assisted living facility, they were now having to look at a skilled nursing facility. So what unfortunately that looked like in that situation was the family and the person was put in that situation uh, because of a lack of real planning on that person's part, really, because people a lot of times have this perception that I want to stay at home, which is perfectly fine, but then will be reluctant about having care in their home. And then we'll delay that. And then when they're ready now to move, now they're typically beyond what the level of care of a location that they wanted to move in. And now they're at the highest level of care, which is a skilled nursing facility, which it's a trend I've been seeing in the last 6 months to a year, more so than I've ever seen in my entire career. Many times when people are looking at assisted living as an option, so you've decided that home care is not an option, people will end up moving out of their home, they'll sell their home and move into assisted living. There are two different levels of care when it comes to assisted living. And when many times people look at assisted living, they really only look at two options. They look at locations that are near their current home or current locations that are near their kids. And that might mean, moving from, Madison, Wisconsin to, down to Springfield, Illinois, or, across the country. So you're removing a person from, their location that they've lived at for 20, 30, 40 years now, and bringing them to a completely different location. And many times the only consideration is just proximity and simply what is around you and what people know of. What you're really looking at when you're looking at assisted living beyond just location is, will this location be able to fit my level of care? And will this, be able to support that? And what happens then when this facility doesn't meet that level of care? In the Madison area, there are two different types of assisted living. And one is called a residential care apartment complex. It stands for RCAC. And then the other level of care in assisted living is called a community-based residential facility. That is the highest level of assisted living care that you can receive in Madison and the Dane County area. The next level of care is skilled nursing. That's typically what people think of, though, when they think of long-term care, is skilled nursing facility. It's the place that you go after you've had a hospital stay and you go for rehab, and people stay for longer periods of time. But what you're really looking at beyond location is really looking at, will that level of care be able to meet my needs? And when my needs are no longer able to be met at that location, what's my plan B? And what I always talk to people about when it comes to long-term care planning is have a plan B always, is because plan B will be used, and most likely plan C and D will be used as well. So does this all make sense, or is this all, that just want to check in real quick?
Yeah, no, you're doing well.
Okay, that what you're looking at from an assisted living facility is, many times people will walk in and that the residential care apartment complex is a level of care in assisted living. However, you're limited by the number of hours, and it's 28 hours of care that you can receive in a week. Now, 28 hours of care may seem like a lot. However, when the minute you put medication management into that, that takes substantial amount of those 28 hours to be able to do that. What that means is that then you no longer are taking your medication yourself, and then you are having a person then, and it's going to be a nurse that's going to be managing your medication list, and then is going to be working with a med passer who is a caregiver at the facility, who's now going to be giving your medication to you at scheduled times of the day. You're no longer responsible for taking your own medication. Even over-the-counter medication, you're no longer taking. So at that point in time, then when you start including then in getting dressed in the morning, and then getting undressed in the evening, getting ready for bed, having a shower, once, twice, 2-3 times a week, and then assistance with walking. There's an assessment process that you will do then when you walk into an assisted living facility, and they'll determine just by asking questions, but then also may even be physically asking you to do things and measuring and assessing what level of care you're going to need. So at that point in time, they're looking at you and saying, well, we think, you're, and they're usually measuring it out to level 1, 2, 3, or 4. And then they'll determine then how many hours based upon what you need at that point in time. And so in some cases, someone comes in and it exceeds the residential care apartment complex level of care. It needs to go to a community-based residential facility. A CBRF does not have a limit on the level of care or number of hours. So it is a level of care that is much higher. So that typically a CBRF many times has memory care in it as well. So someone experiencing neurological degenerative disease will typically be in a CBRF rather than an RCAC. If you also have,
sorry to interrupt you there. We do have a question, and again, you're using these acronyms RCAC and CBRF. Could you just explain those quickly again? What those are, the difference?
Yeah, absolutely. That an RCAC is called a residential care apartment complex. So it's an apartment style standard of living, that you have your own apartments, that you'll typically have a communal dining area and a communal activity area, but it'll look very similar to an apartment complex. That's where the 28 hours of care per base license level of care, but does not have a set number of hours of care per week. It's typically unlimited, and it also typically a CBRF or a community-based residential facility has a memory care that typically is included in there. That's where, or if you're going to look at a memory care, it is going to be a community-based residential facility. Does that
Perfect.
help?
Thank you. Yep, that was helpful. Thank you.
Sure. That's and the hard part is that many buildings that are being built like currently in the Madison area, they have like part of it will be an RCAC or independent living. So this is the trend, is that larger buildings are being built and they're just a beautiful apartment complex style living, and they'll have a certain percentage dedicated to independent living, so there's no level of care being provided there. And then they'll have a certain number of apartments for the residential care apartment complex level of care, and then they'll have a memory care that will be a part of the building. So a building that I work with on the west side of Madison has almost 180 apartments, but they're split between independent living, residential care apartment complex, and community-based residential facility. So the first thing that you would do when you walk into an assisted living facility would be to ask, what level of care is this, and can you tell me what that means? And so enabling the facility to tell you what level of care it is. So when you go in and do a tour, that you're not just looking at the aesthetics of the building, you're not looking at the meal plan or the activity schedule. You're really looking at what level of care is being provided for this facility, and will you be eligible for this level of care. So and as an example, so if you're looking at memory care and you walk into a building that's just right down the road from your house, and it's an RCAC level of care or residential care apartment complex, you can have memory loss and you can live there with memory loss. However, if they do not have a memory care part of the building, and you have advancing dementia, you will not be able to stay at that building. You'll have to end up moving into a memory care. So those are some of the questions that you should ask when you walk in. But many times people just don't, because they're overwhelmed. They've never been into an assisted living facility, and they just don't know the right questions to ask. So by asking the facility to be able to tell you what level of care it is, and at what point in time, will I need a higher level of care, if at all. So hospice can be provided at any of those levels of care, whether it's independent living, residential care apartment complex, or a CBRF level of care. So you can have hospice. Hospice is a separate entity. Hospice means that a doctor has determined that you have less than 6 months to live based upon your current diagnoses for your health trajectory. So does not matter what level of care you're at. So you can have hospice no matter where you live. Would it be helpful if I go through the questions?
Sure.
Because you said you already had 10 questions that were.
Yeah, so again, if people have questions, go ahead and throw them in the chat. We've got about 20 minutes left here on the call. So I could just go through this. I think you've covered some of this, but good to just answer these questions. Number one, what are the projected costs of assisted living facilities for the next, say, 25 years? Another question in that question, how do various facilities vary in terms of quality and what services are offered? I think you just covered that. Is it covered by Medicare? Should one be on a waiting list?
Yeah, those are all good questions. What for a standard RCAC, you are going to look at between $4,000 to $7,000 per month. And what you're going to have, whether it's an RCAC or a CBRF, is you're going to have a base apartment rate, and then you're going to have a care level that will be added to the cost. So you'll have two different rates that are combined that will make up the cost of your apartment and your living costs. So most RCAC level of care is $4,000 to $7,000 per month, and expect on average about at least a 7% increase per year and every year that you live in assisted living at that point in time. In a community-based residential facility, look at between $6,000 to $11,000, and that's a wide range for that. But if you look at most memory care, you're looking at approximately $9,000 a month in the area, and then look at about a 7% increase at that point in time. And then with the CBRF, there's no limit and no cap to the care level. So what that means is that, if you have 4 different levels of care, as an example, there is a caveat to that 4th level of care, and it can continue, the price can continue to go up based upon what your care needs are. So there may not be a limit to what that end of cost would be, but the average cost for a CBRF that's a memory care is between, really approximately I'd say 6 to 8 is non-memory care, and memory care is $8,000 to $11,000 per month. And it varies based upon location, because there's not a requirement. There's not any type of regulation that says this is what the set rate has to be. And many times when you're walking into a building, I would really look beyond aesthetics, and I would talk to the people about the level of care. The first building I worked at when I was in Madison was built in 1992, and we had buildings around us that were brand new, and they just didn't meet the level of care need. So in comparison, now I was working there, 7 years after it had opened up, and people were looking at brand new buildings and wanted to move there. But when they asked what the care level was, the care level didn't meet their need. So I would really look beyond what the aesthetics of a building is, and really can the care level meet your need? Good questions. Well, what's the next one?
Then how does Medicare play in? And then also should one be on a waiting list?
Yes, that's the Medicare does not pay for assisted living care. They pay for skilled nursing care, and they will pay for the first 20 days of skilled nursing rehab, but they don't pay one dime of assisted living care or home care at all. So Medicare does not. Medicaid will, and that's a different topic, but that you can, there's various ways that Medicaid can help pay, but Medicare as a component does not pay at all for assisted living. And waiting lists are, it's really subjective when it comes to a waiting list. Now, what I would say for a community-based residential facility, a waiting list is, you should not be on a waiting list for that level of care, because that is a more emergent level of care, and that's you need a higher level of care fairly quickly. For RCAC, you can do a waiting list. There are facilities that are in the Madison area that have multiple year waiting lists. I would discourage you from getting on those waiting lists, because many times people don't ever make it through that waiting list. What I would say is put a plan in place and be able to make a decision sooner than later, and really not focus on the facility, focus on really what your care need is.
Okay. I think you covered a lot of this. Is it more cost effective to plan to go to a facility that covers all levels of care as one ages versus, starting at a, RCAC and then moving to a CBRF? I I think that's the route you go, right? Or going from finding a place that offers all of the coverage. Obviously, it's going to be more expensive. So, I mean, how would you? I mean, I think one thing that would be good to cover here is kind of comfort keepers and something that, kind of the levels of advice that you can give in walking somebody through all of this. I think we should cover that here in a little bit, but let me just get through these questions. So the next one is what average length of time on a waiting list. You said being on a waiting list is probably, if it's a couple of years, is not a good idea. Is long-term care insurance ever enough to cover all costs associated with nursing home care?
It varies upon the policy when it comes to long-term care insurance. I am a huge advocate of long-term care insurance to be able to be used by people. What I would really encourage people to do is really utilize the plan, and then be able to put a policy in place that what you're looking at for long-term care insurance is really substituting income. It's really the goal is to be able to help increase your income and really what you're looking at is how then can that long-term care insurance policy help cover daily costs. And so that's typically how it's broken down, because long-term care insurance will have it broken down in what your daily reimbursement rate is. And typically the two caveats with long-term care insurance that I'll focus on is if you have a diagnosis of dementia, you do not have to meet the requirement of 2 activities of daily living. So typically with long-term care insurance, to be able to have it be paid out is that you need to have assistance with 2 activities of daily living, whether that is walking, dressing, undressing, showering, those kind of things. People want to start using the policy before you need assistance with those. And those typically are cases where long-term care insurance, people put in a claim and then not get reimbursed for those hours that they utilize. But when you have a diagnosis of dementia, there's no longer a requirement for meeting the activities of daily requirements on the 2 on a daily basis. So if you have that, but I find it an effective tool to be able to supplement. Many times it's a supplement, but it varies by plan and by what your cost was. So typically, talk to your advisor about a typical cost for skilled nursing in the Dane County area is between $250 and $325 a day. When you're looking at assisted living, it's $175 to $225 a day. When you're looking at home care, you're looking at approximately $100 a day up to almost $1,000 a day for care, if you would have care up to 24 hours a day for that. So it varies on, but really, and what you're looking at for premiums and what the cost is. But I would implement using long-term care insurance if you have it. Start using it sooner, but look at also what the trajectory of your care needs are too, and figuring out what that plan is. That's really where a financial advisor comes in to figure out and help figure out what your budget is and how much you can afford, and to be able to budget for the care needs. So.
Okay. What would you say the average stay is in a long-term care facility once somebody enters? If they can't fulfill 2 of the daily active, they can't dress themselves, they can't, shower, they end up in a facility, their memories may be poor. What would you say a typical, stay? How long?
In Dane County, in a community-based residential facility, it's 6 months to 18 months is the average length of stay for that. And then in an RCAC, you're looking at anywhere between 24 to 48 months is an average stay.
Okay.
And then typically in home care, it's it's up to typically a year and a half of time. So people typically start home care and they do, a couple hours a day. They start that and they've had that for, up to a year and a half before they move into assisted living, typically.
Okay. Then we've got a question here. Does the Wisconsin Department of Health Services still have ways consumers can investigate the care, services, sanitation, staffing, and costs of long-term care facilities? They just have a comment after that question. They used to have inspectors, nurses, and investigators that did an annual on-site inspection, and their reports were available online.
You can, yeah. They're the state surveyors, and the surveyors have been, yeah, they still are in place. So you can go to the Department of Quality Assurance, and you can end up in any facility that you walk into. You can ask them for a copy of their survey. They have yearly surveys that that they're mandated to give to you to be able to see what the citations were and what the extents they were. So any assisted living facility that's licensed, then you can walk in and ask for that.
Okay, perfect. Let's see. Last question. Have long-term care services, especially staffing, reached a crisis?
100%, yes. That's however, though, I say that reluctantly because I've been in this field and in healthcare since the 90s, and there's never been a time where we've been fully staffed. There's always been a shortage. What I see today, though, is it's a crisis across all boards. It's from home care to assisted living to skilled nursing to hospitals, and it's grown larger because the number of people who need support and services has exponentially gone up. The caregivers the numbers have not typically gone down. They've stayed about the same, but the amount of people that need care have substantially gone up. Part of the challenge is that the level of care that people are needing have substantially gone up. People have more complex comorbidities than they've had 5, 7, 10 years ago, and that's just meaning that the person has multiple health conditions. They are living with renal failure, type 2 diabetes and dementia, and it's much more complex care than it has been in the past. So yes, companies are working through it and are very careful about adding on additional hours. What I have seen has been a very good representation in Madison of companies not adding on additional hours if they're not able to staff and support. They won't just take on new clients and not able to staff them. So that's been my experience. But yes, we are in a staffing crisis.
Okay. Well, I combined some of those questions, so I'm out of questions. I don't see any more in the chat. So, Darren, if you would just for a second here talk about Comfort Keepers. Obviously, we invited you here. You're a local company. Just about what your services entail. How would they get a hold of you if they wanted to, communicate with you, and if they have an issue?
Yes, no problem. And then there's from Susan about that mom having dementia for 4 years, and that so a plan could be longer. So yes, I mean a person with dementia can live with dementia for anywhere 7 to 15 years or longer with dementia. So yes, I would plan for a much longer period of time, and it can go on for a much longer period of time. What we're looking at are averages of people in facilities. We don't know a lot of times before we've received the call to have services, how long that person has been living at home. And so, yes, people can live much longer. And yes, and so a plan needs to be built for long-term sustainability. But at Comfort Keepers, we've been in the Dane County area and the Madison area specifically since 2001. We're a private company. We provide care in the home from 3 hours a day up to 24 hours a day. It's customized service, and so you call and you can get specifically what you need. So it's a customized approach, so you can have a plan of care that fits exactly what your needs are rather than just a generalized plan. We provide transportation services. All the caregivers can drive, and so we can take people to doctor's appointments and various things. We can help with grocery shopping that way. We offer case management services. So many of these things that I was talking about today, I help people look at assisted living and tour assisted living, help people discuss what budgets are and to be able to go through and figure out next steps for people. And I provide case management services for people who live in the community, but then also in assisted living. Many times, on a note on that, is that people will move into assisted living and think, oh, my services are no longer needed for that. And then typically there'll be a delay or a stoppage of services, 3-4 weeks, and then I'll get a phone call a month after the person's moved in and said, we need more help because to be able to help with doctor's appointments and help navigate being able to work with the facility in different areas. So that case management is an hourly charge along with the caregiving, but you can work with Comfort Keepers and just provide caregiving and never have case management services, or the opposite. You can have to work with me and do case management services and never do caregiving. Yeah, that's one of the other questions is, yes, we do work with the ADRC as well. Yes.
Does anybody else have any questions? Darren, do you have any final thoughts?
I don't. I apologize for the audio before. My goodness, I really wish that wouldn't have happened. And if there's ever an in-person event that you would want me to do, I would come back and answer questions or anything else. I'd be happy to be able to do.
Hey, well, we appreciate you just making it work. So thank you, Darian. If anybody else has any questions for him, you can just let your advisor know. And our next client event will be August 23rd. It will cover tax strategies in regards to Roth conversions, qualified charitable distributions, required minimum distributions with WDS tax advisor Luke Wendt. So if you would like to attend the event, please just sign up on our website, or if you, friends, or family think that you might be interested in the topic, you're more than welcome to invite them to attend. We organize these events to bring value to our clients, to our community, and your referrals amplify our events to our impact beyond WDS. We also welcome the feedback from everyone about our events, so please reach out to your advisor or email us at info@wdstrategies.com to let us know how we're doing or other topics that you'd like to see us present about. So again, thank you, Darian. Thank you, everyone, for joining. We hope to see you at next month's event, and enjoy the rest of your night. Take care, everybody. Thank you.